Hello, we're continuing to highlight the participants of the virtual research poster competition. Joining me today is Grayson Walker. Hey, Grayson.
Hey Kyle, how's it going?
Good. So tell us a little bit about yourself.
Yeah, sure. I'm a combined DVM PhD student coming up on my second year of the PhD program. I really love NC State. I've been studying here since 2013 when I started in poultry science. And that's when I got really interested in bacterial pathogens as they relate to food animal medicine. I currently work under Dr. Luke Borst. He more or less adopted me during my first year of vet school, and no one else wanted to listen to me talk about chickens and bacteria all the time. And here I am today. I'm really happy to be doing what I love with the support of a great community, and also really thankful for efforts made by you, Sarah, John, as well as Dr. Mears for making this virtual research abstract program happen.
Yeah, thanks for sharing. So tell us about the research.
Yeah, so just some background. I study two pathogens. One is E. coli that cause non-intestinal or extraintestinal infections, such as septicemia and urinary tract infections. The other is Enterococcus. This one is more often considered a nosocomial or a hospital-acquired pathogen. They're two really different bacteria, but what we found is that they're both present in many extraintestinal infections, including one of the most common reasons we prescribe antimicrobial drugs in veterinary medicine, and that is for canine urinary tract infections, or UTIs. So the goal of this research was to look at some of our very own patients who have presented with a UTI at our hospital and had E. coli and Enterococcus co-isolated from their urinary tract, and see what the clinical outcome of those patients was, as well as what drugs the isolates were resistant to. We conducted a 5-year retrospective study. Medical records from 2014 to 2019 were searched to identify 50 patients with the E. coli and Enterococcus mixed urinary tract infection. And we compared these to control populations of dogs that had monoculture results of either E. coli or Enterococcus. What we found was there was a greater prevalence of UTI recurrence among co-infection patients. Speaking of antimicrobials, we also found that E. coli isolated from co-infections were more resistant to drugs commonly used to treat UTIs. And that may in part explain some of the recurrent UTIs we saw in that population. So with these data, we hope to do some more prospective experiments. I'm interested in how these two microbes interact in the canine urinary epithelium and during antimicrobial therapy. And Dr. Jess Gilberti and Dr. Jacobs' lab has been a huge help to me in planning some of those experiments. So this poster is a start, but hopefully this work will serve to inform clinicians of some interactions between different uropathogens during infection, and hopefully lead to improved therapy for canine UTIs.
Fascinating. Well, thanks for sharing, Grayson.
Thank you so much, Kyle.